What is cystometry and what does it measure? Imagine trying to understand how well your bladder works, much like testing a water tank's pressure and capacity. That's exactly what cystometry does. It's a specialized test used by doctors to see how your bladder stores and releases urine. During the test, a thin tube called a catheter is gently inserted into your bladder through the urethra. Sometimes, a second catheter is placed in your rectum or vagina to measure abdominal pressure, helping to distinguish between bladder pressure and pressure from your abdomen. Once the catheters are in place, your bladder is slowly filled with sterile fluid, usually at a controlled rate. As it fills, the device measures the pressure inside your bladder. This helps doctors see how your bladder muscles, known as the detrusor muscles, respond to filling. They look for involuntary contractions or spasms that might cause symptoms like urgency or incontinence. The test also measures how much fluid your bladder can hold before you feel the first urge to urinate, which is called bladder capacity. It records when you first notice the need to go and when your bladder feels full. During the process, you may be asked to urinate into a special container, allowing the doctor to measure the flow rate and the pressure your bladder generates to empty. This part helps assess whether your bladder is emptying properly. Another important aspect of cystometry is checking how well your bladder muscles coordinate with the muscles that control urine releases, called sphincter muscles. Proper coordination is essential for normal urination, and any disruption can cause issues like incontinence or retention. Overall, cystometry provides detailed, objective data about how your bladder stores and empties urine. It is part of a group of tests called urodynamic studies, which help diagnose problems like overactive bladder, urinary incontinence, or bladder outlet obstruction. It's especially useful if nerve or muscle issues are suspected, such as in neurological conditions or after bladder cancer treatments. This test helps healthcare providers understand your bladder's function, guiding them to develop the best treatment plan for your specific needs. If you're experiencing urinary symptoms, talking to a healthcare professional about whether cystometry might be helpful is always a good idea. Remember, each person's bladder is unique, and your doctor can provide advice tailored to your individual situation.